another pandemic, which was hunger. A lot of women were calling us of hunger.
The issue of the market. I mean, look at our Plateau State, for example. You lock up a state for a long time and you open up people and they go to market and interact, and a very large amount of people come to market too.
There is a certain segment of the society that refuse to believe even COVID does exist.
A lot of youths were consuming fake news right, left and center.
A lot of people were scared. The lack of information, adequate information about the virus itself.
As if it was a death sentence and nobody wants to die. Even a doctor, nobody wants to die.
The community where that girl lived was literally deserted. It literally turned to a graveyard.
So I will look at the psychosocial effect is what led to that.
A situation the youth were not prepared for. They never experienced such a thing, and the entire world didn't even prepare for a pandemic like this.
Right now, let there be a clear information, measures of information dissemination.
It is no longer news that the year 2020 was characterized by the outbreak of the dreaded COVID-19 pandemic. In Plateau State, the first case of the coronavirus was recorded on Thursday evening of the 23rd of April 2020. This was while the world was still grappled and trying to learn about the symptoms and prevention of the dreaded pandemic. The World Health Organization WHO had earlier on 30th January 2020 declared the outbreak of COVID-19 as a public health emergency of international concern and a pandemic on 11th March 2020. This was followed by a series of lockdowns and restrictions as various governments responded rapidly to control and curb the spread, which was proving fatal in so many parts of the world.
At the very beginning, most of people in the academic found it very hard to believe it because most of them have only read in books. I read a lot about pandemics in books. And of course, pandemics happened not at the global scale in which it happened with COVID-19. Usually you hear of maybe one form of pandemic happening in one area or the other, but none to the point that borders were closed. So these were actually new issues to us in the academic world. But of course, at the end of the day, since it's a pandemic, it's a known reality that the impact will be felt by another person. So we're actually standing at a gap to watch what really will happen. Would the pandemic be able to have influence in Africa, or will it just end up with the Western world? And actually, when it came to Africa and the rush from the state to close borders, to close whatever, actually affected the academics. Schools were closed and also were affected.
I tagged the COVID-19 situation in Nigeria a pandemic inside a pandemic. This is because of the fact that Nigeria was already ravaged with a lot of violent conflicts. We know the issues of Boko Haram, banditry, kidnapping. In fact, so many communities were already overheated with these challenges. And then here comes the issue of COVID-19, where a lot of people in Nigeria had to find themselves inside the houses. They were not able to go out for months in their homes.
The COVID-19 pandemic disrupted every life. Children inclusive, parents, everybody in the society went through that shock because it wasn't a prepared situation.
The index case in Plateau State being a lady who exhibited symptoms and had her sample swab taken for COVID-19 testing, with various reports making the rounds that she just came back from Kano State, which had already recorded double figures cases of the pandemic. The concern and questions for others, however, was how someone would have come into Plateau State despite the fact that the borders were said to have been closed. The Nigerian Center for Disease Control, NCDC, later confirmed the recorded case of COVID-19 with a national update, which was then recorded at 108 new cases nationally, with an index case in Plateau, thereby taking the toll in Nigeria to 981 persons who have contracted the virus as of 23rd April 2020.
And therefore, from my experience, when it was reported, the community where that girl lived was literally deserted. It literally turned to a graveyard, you know, with silence, no activity going on. And I took the risk actually to go in and interact with people. And what I found was appalling, was actually heartbreaking. I found children who could not find food, old women and youths who could not actually get food for themselves, because anywhere they went to buy food and they were identified to be from that neighborhood, they were discriminated, they were, you know, stigmatized. Many people actually ran away from them. Someone told me of how he struggled actually for days, you know, to go out of his community to a neighboring community to buy food for himself when the lockdown was relaxed for some hours, but nobody could, you know, take him on their cap because they felt that he was going to infect them with the virus. Meanwhile, it was just one girl that was reportedly diagnosed with the virus from that community, and she hardly even stayed for up to 24 hours when she came, you know, from her journey in the northwestern part of Nigeria, you know. But then again, the effect was actually felt on everybody within the community, and even I myself, who went in there to go and report the case, coming out, it was more like just living in isolation, you know, on my own, because many people who knew that I went there, especially those who came, you know, in contact with my reports, you know, felt that I had also been exposed, and therefore I was a threat to them.
The index case, the first person that was brought to the hospital that was reported was the first person that had COVID-19 in Plateau State. If one looks at it through the scientific lens, one will know that yes, it is very likely that there are several cases. But as far as the report is concerned, yes, of course, there was an index case that was first reported, and there was so much fear, there was so much resentment, there was so much misinformation as a result of that. And it starts from even the health workers. People will not want to come close. Then secondly, the immediate family of the person, the larger community, and the public reaction to the circumstances that brought about the diagnosis and entry, because at that time there was a restriction of movement between states.
The reports of the first case in Plateau State was greeted with a lot of mixed reactions on how the virus would have come into the state. There was general fear by citizens of Plateau State and some amount of stigmatization on anybody who was suspected to have any trace whatsoever of the virus or who has been in close contact with suspected cases.
Since the escalated detention was the diverse views about the COVID virus itself, because basically it's something new, and then it was also helped by the fact that a lot of misinformation was going around. There's this gory picture of the virus that was painted to people, and then a lot of people were scared. The lack of information, adequate information about the virus itself, how it can be contacted, how it can be managed, and all were really scarce at that point in time. So
what amplified the fear was the fact that there was no real guideline for treatment for the COVID-19. There was no real, okay, you could do this. You know, medicine where you see this, you do this, it gets better. You were evidence-based. So as at then, there was no much information about what you could do exactly. So it was as if it was a death sentence, and nobody wants to die. even a doctor. Nobody wants to die.
There was also a blame game and accusations laid on the part of the government and security personnel over laxity, given that the borders in the state were supposed to be shut down. As such, no one was supposed to have come into the state, especially persons coming from states with already confirmed cases. But the question is, can you really shut out the dreaded COVID-19 virus outside a state like Plateau State, with a population of over 3.5 million people, covering a land size of 30,913 kilometers square?
The location of Plateau State and Jos is peculiar. This is actually the middle of Nigeria. Don't forget, FCT, part of Plateau was taken when it was old Plateau. So Plateau has a boundary with all over the states. On this side you have Taraba, on this side you have Bauchi, on the other side you have Kaduna, you have Nasarawa, you have, all around. So it is difficult to monitor when you have this kind of situation. The cosmopolitan nature, there are certain locations in Nigeria where if you meet 10 people, Plateau State has that peculiarity, especially Jos. If you meet 10 people, maybe only 4 will be from the state. So there is not because of the commercial activity, it has that thing, that long-term thing. So people move in and out from these states. So it's very difficult to police the people.
At that time, there was a restriction of movement between states. But one thing that, and it is general that normally in the control of any outbreak, control will start from international boundary to interstate boundary. But just know that in our setting, it is generally a big challenge to say that there will be a clear restriction of movement in between states. But just to tell you that whether, even though it is publicly said that yes, there was an index case, but as a scientist, I believe that there were several cases that were not picked.
The restriction measures that were instituted were like a new normal, and people were not finding it easy to stay in one place. We had issues. People escaped the quarantine sites that were designated for that, went to their to join their families. So if those people were infected, definitely the spread of COVID-19 would have gone into the nooks and crannies of the state.
The interplay between social media and the spread of misinformation and disinformation during the COVID-19 pandemic was also intense in Plateau State, just like other parts of Nigeria and even globally. The fact that the pandemic was new and that no one saw it coming meant that many people were scared, leading to various theories and premature reports on what was the cause and how best to stay alive. A lot of misinformation and disinformation was dished out as facts, even by healthcare professionals who should know better. Some were untrue beliefs and myths peddled by non-medical actors, and in some cases just for mischief. This further gave rise to the high level of uncertainty and fear, mostly leading to stigmatizations of persons who had anything to do with the pandemic.
So people were desperate to get the information to stay updated with the COVID-19 situation. People were also desperate to get information on whatever social safety nets, economic social safety nets that's available or government is providing, so that they will cash on that. And in that desperation, a lot of people, even people who want to manipulate people, ignorant people, as well as people who will gain from misinformation, used misinformation to even defraud some people. There are a lot of people who were defrauded based on the COVID-19 palliative, COVID-19 grants that was given by government.
The state also did a lot of things in terms of misinforming people, because it amplified where it is not supposed to. When you create fear, fear leads to intimidation. When people are intimidated, they react very violently. That actually ended up with the fear of COVID-19, the hunger of COVID-19 brought in NSAS.
It is the same thing over the decades, that whenever there is a new infectious disease, there is so much fear, there is so much apprehension, and everybody becomes an expert, and everybody listens to any information that is thrown at them.
The index case in Plateau State was later discharged on Thursday, May 7th, 2020. But you can only imagine the feeling of frustration and stigmatization she faced from her family, her immediate community, and persons who didn't even know her. Being declared free from the virus, she was now burdened with the task of reintegration back to her community. The feeling of shame, hopelessness in isolation is of great pain. The lack of understanding by family, friends, and others around meant fewer opportunities for reintegration or any kind of social interaction for persons who contract the virus but have recovered.
Relating, of course, with government officials, communities as the pandemic spread, even created an unfavorable image or perhaps receptibility for us as journalists. Personally, I had to, try to talk people into accepting me most of the time. You hear people telling you that, look, you relate with these people, and so I don't trust you. And so sometimes you wonder even how to carry out your job, and sometimes you have to rely on, the availability of technology, social media, and others to gather information from which, you write your reports.
Stigmatization of any kind is not good. It worsens an already bad situation, especially when it comes to a medical emergency such as this. They didn't ask for it. They didn't go looking for the disease. They didn't have a risk factor for getting that disease. It happened. Each and every one of us were exposed to the disease, but they came down with it. Life happens like that. So we should see it as, okay, I was lucky not to have this, but this person, A or B, wasn't lucky not to come down with it. So yes, the person came down with it. We should offer them a form of support. Yes, COVID-19 is something that you don't come close by and say you want to do everything for them. But from afar, okay, we're with you. We know you'll come through this. We know that you, and then ensure that their jobs are kept for them. It's not a death sentence. It's not something that when they come out of, they will now begin to think of how they will put their lives back together. It's something that their lives should be at least kept for them in such a way that when they come out from it, they'll be able to come back in and be integrated into society.
After the index case, Plateau State continued to record even more cases of the pandemic, and soon afterwards overtook other states in numbers of recorded cases. The question is how the state would have been counting more numbers despite the proactive measures put in place by the state government, especially the countless lockdowns.
Despite those measures that were put in place, people still smuggled their way through, find their way through of coming into the states. And some from our data, the cases we've been recorded, initial cases we've been recorded were people that were coming into the state from other neighboring states or from other states that were having the COVID-19 pandemic.
The basic challenge there on the number increasing was that there is a certain segment of the society that refused to believe even COVID does exist. Because regular weekly worship did not stop in certain places. Some communities and some adherents of certain faiths did not believe in any washing hand. They tell you, how can you tell me a hand sanitizer that has 100% alcohol base, you tell me that I should rub it? So he considered it as an impurity when he wants to go and worship. Some other religions too just felt that What kind of religion will say they should close our place of worship, close our church? What kind of disease is that? That's where we should go and pray so that the disease will not come, and they say we should not go to the place. So all of these things affected and then Plateau State, when it comes to religion, So these two things affected the spread negatively.
It came by surprise. And then when we saw it coming and when it came, we now had to borrow. We like borrowing from the outside world. We borrowed immediately that everybody should lock down, everybody should be at home, without looking for another way to make sure that we are able to, accommodate the situation we have in Africa. In Africa, Nigeria cannot pay for every individual. 200 million people, will you be able to give them allowances every month to stay at home? It's not possible. So we needed a very creative way of handling ours and not to lock people down at home. We are still suffering it up till now because of the fact that you lock everything, and these people are people that when they don't go out, they won't be able to eat. When they don't produce, it's a challenge. If you get to the market today, a mudu of rice is no longer affordable by the poor man. These are all, carry over from COVID experience, carry over from issues of Boko Haram, carry over from issues of banditry in our communities.
So the lockdown was a national thing. So first of all, Plateau State government lockdown. And then taking charge of information dissemination. That took a bit of time before we actually got ourselves, because we had diverse channels of information emanating from government. And then with the panic, first of all, the lockdown was necessary to actually calm the panic so that everyone is at home. In fact, for government to even begin to understand what the virus is. And so that was lockdown. That was what necessitated the lockdown. And then, of course, to avert any form of spread that could go around. And then, most importantly, the fact that we started the COVID-19 situation room, where we have phone numbers, toll-free lines out for people to call in case of any emergency. And of course, the task force was set by the government also. All this is for the purpose of having a one source of information in and out. So, and also for policymakers to make decisions regarding the spread of the virus. And then ultimately, I think what we were popular with is the setup of the CCTV cameras across all our borders, and also involving vigilante and neighborhood watch in enforcing the lockdown. So these, I would say, are the major steps we took during the COVID-19.
The rapidly evolving situation of the pandemic seems to have made the entire world pause for a moment. Things have been changing extremely and rapidly. The COVID-19 global health emergency has had much more economic and social impacts that have disrupted nearly all aspects of life for all groups in the society.
Nigerian youth, in a sense, we were really hit by the COVID-19 pandemic. We were hit by it. And then the fact that a lot of youths are struggling. Unemployment is widespread in Nigeria, and we are trying to come out of it. And a lot of Nigerian youths are self-employed. Self-employment in the sense that a lot of them earn per day and use those earnings to sustain themselves and to keep the business going. The business are not really that profitable, yet for youth. So the pandemic affected us in a lot of ways. Youths who are in school couldn't attend classes. Education was disrupted.
If you look at the positive impact, it made some of the youth to think beyond classroom. They went online, and some of them engaged in the online tutoring. During that lockdown, people were compelled to engage in online meetings, including the youth, and that is very positive. Some who will spend time on social media chatting now spend time doing something more constructive and productive. And some of them who are very proactive began to sell their commodities, their items they produce online. They learned how to do online marketing aggressively, and they were positively engaged. Utilization of the technology became very, very positive. But on the other side, some of them used it negatively, continue to amplify and recycle pictures that are very, very disturbing. And those ones were instigative to some extent, because some will feel, okay, we've been deprived and something has happened to us and we need to retaliate, things like that. But we need to refocus the minds of the youths, looking at these examples that I have mentioned, to show them the results of both of them, and then to encourage them to continue to engage positively with the technology to add value to their lives, and also to add value and impact in the society where they live.
The crisis, apart from being a global health emergency, also posed considerable risk in the fields of education, employment, mental health, and disposable income. While youths and future generations will shoulder much of the long-term economic and social consequences of the crisis, their well-being may be superseded by short-term economic and equitable considerations. To avoid exacerbating the intergenerational inequalities and to involve young people in building societal resilience, governments need to anticipate the impact of mitigation and recovery measures across different age groups by applying effective governance mechanisms.
Appropriate response starts before any outbreak of disease. So, and it's important that all specialists should be on board. And when I say specialists, it's not only those health workers, co-health workers, including the media, including those social scientists, because all of these, they are critical stakeholders in the response. You don't start to respond when there's the outbreak. So for instance, one thing that I will be very frank with you as an infectious disease expert, I tell you, yes, today we have COVID-19. Tomorrow we'll have another thing. And there will be another misinformation. So way forward is that right now let there be a clear information, measures of information dissemination.
People like Matthewtegha should be able to choke the space with more positivity. There's too much negativity, and within the Nigerian context, it is more celebrated. Negativity is more celebrated more than positivity.
We have to address this psychosocial effect, because some of these young people left school and have not gone back because their parents lost their means of livelihood. What becomes of them? Eventually they will be lured into some kind of mischief easily. So there's need for an intervention to be put in place for counseling, for encouragement, so that they are reintegrated back into their educational system. Because the issue of psychosocial effect is still there. It has not yet been fully addressed. And I am advocating strongly that we need to put something in place to address that one.
We must continue to appreciate and support the efforts of the World Health Organization, WHO, the Nigerian Center for Disease Control, NCDC, and other government agencies and policies that are responsible with outlines and practical measures for overall recovery and to ensure that no one is left behind. The society must intensify efforts to fight misinformation about COVID-19. Sharing the right information with family, friends, and colleagues will help ensure people have the facts about COVID-19 and can protect